Welcome to another episode of Dental Talk 360, a podcast that was curated by a team of dentists to make dental topics more understood and simplified for our patients. In today's episode, we will be focusing on the topic of orthodontics and clear aligners. I'm Dr. Melanie Silvestrini.
I'm Dr. Oscar Sanchez.
I'm Dr. Barton Santos.
I'm Dr. Alfredo Raus.
And today we have a guest speaker, Dr. Sofia Arauz. She's a general dentist and director of scientific affairs for 3D Predict, an AI-based company that creates clear orthodontic aligners. So thank you for coming to our podcast today.
Thank you for having me.
So we would like to begin the podcast speaking a little bit about 3D Predict and how it is a clear aligner company and what clear aligners are.
Perfect. So basically, clear aligners are a new option. Well, it's not so new. It has been in the market for almost like 20 years, but new to some patients, right? That they are an option to traditional braces. What's different about 3D Predict is that we actually take into account what I like to call the full orthodontic anatomy of the patient. So we take into account the root, the bone, and the crown of the patient to move those teeth within anatomical boundaries. Nobody else is doing that. I mean, some other companies might have some type of integration of that 3D X-ray. That's what we will need. But our protocols are based on that information. So that's what makes it more predictable and safer for you. So that's where the name 3D Predict comes from. But we'll talk more about that in a little bit too.
Amazing. How have clear aligners benefited you guys as general dentists in your practice?
Well, it's been a huge benefit considering some adult patients that had braces when they were younger, now that have rebound crowding or rebound malocclusions because let's say they didn't wear the retainers. Now they need to get orthodontic treatment again. They're, if they're in the public eye or if they work with people and they don't want to wear traditional braces, majority of them, I would say. So it's having a clear aligner orthodontic therapy has been great for them because they could straighten their teeth while having semi-invisible treatment in their mouths that they could walk around, function every day, and they're very happy. And I've never had an unhappy patient using clear aligner therapy as long as they were compliant, right? So making sure that they're wearing them as recommended and suggested, and pretty much it. What about you, Dr. Barton?
I think the name of the game is you want to be minimally invasive. So clear aligners allow us as dentists to put the teeth in harmony and everything is balanced. And, we may not be born with the perfect teeth, the perfect shape, but once everything is set in perfect position, then we can build that as a solid foundation and give you that beautiful natural smile, give you the OM 3, 2. But, yeah, definitely clear aligners are I feel essential to creating a natural, beautiful.
I agree, especially in cosmetics when we're trying to restore, which we'll discuss later. We're trying to restore veneer cases or restoration. Sometimes you have to create spaces or reduce spaces and put the teeth into the proper position in order to make it minimally invasive as far as the restoration, to do minimal preparation veneers and what have you. I think they're important, which is great with 3D Predict because it's not only using the teeth, but it's using the root structures and the bone structures to move the teeth into the proper position very predictably, i.e. 3D Predict, right? Because you're using the CBCT, which is that three-dimensional imaging, to allow to move the teeth in such a predictable manner without compromising bone loss and other issues that can happen when dentists do them blindly, right?
Exactly. So, Dr. Sofia, how would patients benefit from clear aligners based off your experience and with 3D Predict?
Well, that's a great question because we work with a lot of general dentists, right? And a lot of our dentists say to me on a daily basis, I really don't have any clear aligner cases. And it blows my mind because patients that have crowding, right, are great candidates for clear aligners, but also patients with relapse. And for those patients who don't know what relapse is when your teeth move back, right, after you have had ortho treatment. And the issue with relapse, and now that you brought it up, is that once you have ortho treatment, your gum health, your bone health might have been compromised, right? You move those teeth within the bone. We don't know if those roots of those teeth, where they were moved to, because a lot of those treatment plans are not considering your bone and your roots. So now we're thinking of safety and where to bring that treatment back into where the patient can be safe now if there has been some compromising, right?
Mhm.
So any patient can benefit from clear aligners, to answer the question. Like,
And any age, right?
at any age, right? We think about children. I mean, children can start not clear aligning treatment, but we certainly can do clear aligning treatment on the preteens and teens and some other ages. But also adults who have orthodontic treatment can benefit from it. And if you have some other issues that you need to be corrected, for example, you need a space for your crowns, you need a space for your implants, and your dentist have been telling you, well, I would like to place this implant, I would like to place this crown, but I really don't have a space here. So now I need to crown this other tooth, and I need to crown this other teeth on the side because they have basically invaded that space. Now you have a more conservative option, right? Because I'm a conservative dentist too. I like that word. To be able to create that space. And talking about a little bit about timing, a lot of patients think about, oh my God, but ortho treatment, whether it's clear aligners or braces, it's gonna take me like a year. I don't have a year to wait for the space to open. With Treated Per Day, you can create that space within a couple months. If you're moving 1 or 2 teeth, it might take 2-5 months to make that space. I mean, think about it. You don't need to crown those other teeth that are healthy. You don't need to shave them off, basically. That's what we're talking about. So any age can benefit from it. And not only for crowding, not only for underbite, not only for overbite. There's a myriad of things that you can do with clear aligners.
It's a great point that you made about the duration of orthodontic treatment. A lot of patients also don't realize how important the compliance is, the at-home compliance is, especially with clear aligners and how that differs from braces. Let's talk a little bit more about that and the differences between traditional braces and clear aligners.
Well, with traditional braces, historically it's been longer treatments, right? So 2-3 years. I mean, I've had patients personally in practice that I've had braces for 5 years or 6 years, depending on how bad they were. And they used to have headgear, but they used to have these things stuck behind their head, push them back or forward. And a lot of people, when you say orthodontic treatment, that are in my age range, that were born in the 80s, think of kids that we saw back then with all that. And now we could tell them, look, there's ways of being able to move those skeletal class defects that used to need headgear now with 3D aligners, which is amazing to me. Because just think about how great technology's gotten, and in our dentistry field, how far advanced we've gotten now. Now we could do that with just a simple clear aligner tray that they could put on and then take off. And they won't have something that's fixed in their mouth that could cause gum soreness or ulcerations in their lips, because now they have these metal brackets that are in the front cutting them, or the lingual versions, which is when they put the brackets behind their teeth and they get their tongue scraping or lisp. So now you're able to do these kind of treatments nowadays with a clear aligner that you could remove, that you could place on as long as you're compliant. 21 to 22 hours a day is what I normally tell my patients. Make sure that you take them off to eat and wear them all day otherwise. And they get that treatment very predictably in a short amount of time. So on average, my patients will have their aligners between 4 to 6 to 8 month range, right? Never a year, right? Obviously, there's patients that have longer treatments and that have severe crowding or severe crossbites that need a little bit more attention and time. But those are very rare on the day-to-day cases. You're obviously going to have outliers like in anything, but for the majority of the time, you're going to have these shorter cases that you could treat them and get them where they want to be, and makes me happy and them happy at the same time. What about you, Dr. Santos?
No, I agree. So I always tell my patients that clear aligners opposed to braces, for me, is like a custom suit, because I'm a guy. When I grew up, you get
Speaking
braces
of, that
suits.
suit looks very good.
Thank you. One of my friends in my patient, he made it. This is actually 8 years old. This suit.
Nice.
So yeah, still but I have very wide shoulders and I have a very slim waist, 28 waist. So the thing about clear aligners is it's custom movements for teeth. It's bespoke. So you're able to push teeth and only the certain teeth that you need to push, whereas traditional brackets and wires, you're moving in like a group function type. And because you're moving the teeth specifically that you want to move, the time is shorter than traditional brackets and wires. And I find that patients are more compliant because they're more, they're excited to wear these clear aligners and they can maintain and keep their teeth clean. Whereas, I mean, when you have braces, it's hard to
hard
get.
to
You got
floss.
food, yeah. It's
Floss,
very
you get a lot of
challenging to keep.
inflammation on the gums. They're
Yeah.
take care of it.
I mean, when you get the brackets
Yeah.
off, you got
Gingivitis, inflammation.
and staining and fluorosis, and it's just it's challenging.
It is.
Yeah, in general, it's very convenient. The aligners for me, most of my patients they love it because it's something that they can wear all the time. Nobody notices for the most part because, like I said, it's a clear aligner, and also it's something that allows them to carry their daily activities without having that inconvenience. So it's
And secondary to all of that is less traumatic. So let's be, as doctor mentioned earlier, being more conservative. One thing that you'll see with traditional braces, not all the time, but a lot of times if they do those treatments with conventional braces too quickly, they start getting what's called blunting of the root tips, where the root tips now getting resorbed, which most patients won't see that, only a clinical dentist will that's licensed to see the radiographs. You'll see that the roots over time have been foreshortened, which could lead to issues down the road with tooth mobility, tooth loss, compromise a lot of treatments. And that's an unfortunate event because of that group movement. Because when you do traditional braces with brackets, it's a little bit more forceful. It's pushing the teeth through bone. It's not as passive as a clear aligner therapies would be. And now with 3D Predict, you can move those roots and the tooth structure in a perfect harmony without compromising that blunted nature of it. And that's what's amazing about it.
I think the beauty of 3D Predict is the fact that with the CBCT, you see how you start and then you see how you finish. I think traditional orthodontics back in the day is you took the pan and you took the ceph and you really didn't monitor closely how movement with the roots and the tooth and the clinical crown was. But with the 3D, because we live in the 3D world, panoramics are two-dimensional. You don't know, okay, teeth may appear in harmony, but the roots might be out of bone and they're in the gums.
Yeah, you
And
know
then,
what-
as
you
the
know what-
general dentist, we see this. The
You have a
specialists
3D
don't see
patient.
this. Yeah,
You need a 3D X-ray.
exactly.
Yeah,
Yeah.
and 3D Predict, going back on his tailored suit, it's you're getting a blueprint of exactly where you're going to go, not only
Yeah.
tooth position, but root position to keep everything in house and
Yeah.
clean and atraumatic as possible. And it's exactly what you're going to get. So it's literally like you customizing a suit, you know that that's what you're going to get.
You
It's
get that
bespoke for you.
solid foundation.
Exactly.
Yeah.
Thank you guys for all of the amazing feedback. And if you guys would like to stay tuned for our second episode, we're going to go more in depth about how 3D bone analysis through a CBCT can be absolutely beneficial for orthodontic treatment. Thank you for listening. I'm Dr. Melanie Silvestrini.
I'm Dr. Oscar Sanchez.
I'm Dr. Barton Santos.
Dr. Alfredo Rose.
And I'm Dr. Sofia Arauz.